Thank you, Andrea, for these kind words. My sister, Dr. Joy, and my boss, because she's the chairperson of RBM board, and I'm a member of the board of RBM. Colleagues from MMV and all participants, I'm really delighted to be in this session where we'll get more information about the strategy that MV developed and allow me to give few remarks that I prepared. 25 years ago, the international community pledged to reduce the burden of malaria. An estimated 2.1 billion malaria cases and 11.7 million malaria deaths were averted globally in the period from 2000 to 2022. This is according to the last World Malaria Report. But today, malaria remains an urgent public health threat. In 2022 alone, we reported 249 million cases of malaria and 608,000 deaths, mainly among African young children. Not only malaria is still with us, but progress to reduce case and death numbers is off track. Putting malaria control efforts back on track will take a major global effort that draws on multiple interventions, including vector control measures, vaccines, diagnostics, preventive and curative medicines. MMV works focus on the key role played by medicine, where historical inequities in research and development access have denied communities across the world the treatment they need, especially children and women of reproductive age. Saving these and many more lives will require investment in strong health systems with good quality, and it will require resources to ensure appropriate interventions to prevent and cure malaria for all in need. This includes medicines for malaria prevention and treatment. The recent emergence of partial resistance on artemisinin in Africa, together with possible signs of resistance to partner drugs, call for investment in new and better medicines. Climate change poses an added threat to malaria responses worldwide. In recent years, extreme weather events like floods and shift in temperature and humidity have disrupted seasonal patterns of malaria transmission. In some cases, we are seeing the emergence of malaria in previously unaffected areas. This has put population with no or low disease immunity at risk. The challenge of malaria is further amplified in settings where there is mass population displacement, conflict, and humanitarian crisis. WHO Global Technical Strategy for Malaria is a comprehensive framework to guide malaria endemic countries towards a 90% reduction of malaria incidence and mortality rates by 2030. This means working to expand access to and to maximize the impact of existing malaria medicine, as well as hastening innovation and implementation research to support the development and uptake of effective new tools. WHO is committed to support the development of new tools and their faster approval and related guidelines in a way that reforms is conducted for a predictable, parallel, coordinated, and predictable mechanism to develop guidelines and recommendations, and at the same time having new health products pre-qualified by WHO. We have seen progress, but the tools to beat malaria need to be deployed more strategically, and available to all. This can only be achieved through stronger and more equitable public and private civil society partnership. I think MIM is a good example where we have everybody together: public sector, private sector, civil society, and academicians. I don't think there is anyone missing in MIM partnership. To end malaria, it will require the commitment made during the recent Malaria Ministerial Conference in Yaoundé, Cameroon, to be translated in actions and resource to harness this partnership and deliver bold agenda. As WHO, we are proud to partner with MMV and others in an end-to-end approach that ensures that all those in need benefit from the full range of malaria interventions and quality health care services. I thank you, and to MMV, I wish happy 25th anniversary. Thank you.